This section is on tuberculosis and histoplasmosis. When we start talking about tuberculosis, we'll think about the signs and symptoms of TB. So a cough, bloody sputum, chest pain. Patients may have anorexia and weight loss. That often shows up in questions on tuberculosis. Malaise, fatigue. The fever pattern is very important to note. In tuberculosis, the fever is usually in the late afternoon or evening, followed by night sweats. So they wake up in the morning and they've got a nice normal temperature. By afternoon, evening, they've got a fever, night sweats. So someone with a cough and night sweats, we really want to wonder if this person has tuberculosis. Now, there are other things, of course, that will cause night sweats. Other infections, even menopause can cause night sweats. But that is commonly shows up in questions on tuberculosis. Now, to diagnose tuberculosis, we need to think about the skin test, sputum, gastric analysis, and chest x-ray. Now, if you look at that list of items, which one is most conclusive for the diagnosis of tuberculosis? And the best answer is sputum. When a patient has a positive skin test, it simply says that they have antibodies against tuberculosis. But you can have a positive skin test and not have active tuberculosis. You could have a positive skin test if you have had antibodies against if you have been immunized against tuberculosis with the BCG vaccine. A positive chest x-ray simply has shadows, and it tells you that there's something going on in the lungs, but it doesn't prove it's tuberculosis. A sputum, we actually see the organisms, and that is conclusive for the diagnosis of tuberculosis. Now, we don't usually do a gastric analysis to diagnose TB, but it can be done. Now, when you get a sputum, you note that the order says for sputum for AFB and culture. AFB is acid-fast bacillus, and that means that acid does not kill the bacteria. So if you had a patient that you were pretty sure had tuberculosis, but you were having a very difficult time getting a sputum specimen, you might want to do, or might be ordered for you to do, is to do a gastric analysis. So you have the patient stay MPO, then pass an NG tube down first thing in the morning, aspirate the contents, and they should be able to isolate the organism. Remember, it's acid fast, and the acid in the stomach won't kill it. And what have they done with their sputum all night long when they've coughed? They've swallowed it. That's right. So there's sputum in the stomach, and we can often diagnose it that way. Now, the skin test, you remember, is that intradermal test, and it's read then 48 to 72 hours after the test has been implanted. We need to think about some of the drugs that are used in the management of tuberculosis. Isoniazid, or INH, can be used in the treatment of active tuberculosis. It is also used in the treatment of patients who are skin test positive and X-ray negative. So we use this prophylactically in patients who have been exposed to tuberculosis, have converted and become skin test positive. And we do this to help their body fight off tuberculosis. INH has been on NCLEX numerous times, and there are some important things to know about it. INH can damage the liver. So prior to starting INH, the physician will probably order baseline liver function tests, and then they will be done periodically during the time the patient is taking INH. INH, or isoniazid, can also cause peripheral neuritis. And to prevent that peripheral neuritis, the patient is usually given pyridoxine or vitamin B6. Sometimes it's in the tablets, sometimes it might be a separate tablet. Another drug used in the treatment of active tuberculosis would be rifampin. rifampin turns body fluids red-orange. It can also affect the action of many drugs, including antibiotics. So in a patient who is on rifampin, you'd want to be sure you had an accurate drug history because it could alter the effects of many other drugs. PZA, pyrazanamide or PZA, can raise uric acid levels, so it means that it could give the patient kidney stones or gout. It can also damage the liver, so you need to monitor liver function tests as well. Ethambutol can cause eye problems. It can cause optic neuritis and a red-green color blindness. So if we look at those drugs that are used to treat for tuberculosis, you notice that there are some severe toxicities, liver damage, your sputum and your sweat turns orange. You get gout, kidney stones, and you could get eye problems and go colorblind. And remember that also sometimes streptomycin is used, and streptomycin can cause hearing loss and kidney damage. So we have some very serious side effects from tuberculosis. But if you don't treat tuberculosis, you'll die of TB in many cases. So it's important to treat it. The treatment regimen for active tuberculosis is daily administration of INH, rifampin, PZA, and ethambutol for 8 weeks, followed by 18 weeks of INH and rifampin. So you can see we've got a good at least 26 weeks of treatment here. Now, if the patient is being given isoniazid prophylactically, they're likely to get it for 12 or 18 months simply to help the body fight tuberculosis and help them not develop TB. All right, let's take a look at a question. The nurse in an outpatient clinic is doing an admission assessment on an adult male who states he has had blood in his sputum for several days. He also states that some of the people with whom he works have tuberculosis. What additional information should the nurse obtain during the admission nursing history? 1, has he been having frequent episodes of diarrhea? 2, has he lost weight over the past few months? 3, does he awaken with a high temperature that subsides during the day? Or 4, has he had urinary frequency and urgency with urination? And the best answer to this is answer number 2. Weight loss is very common in persons with tuberculosis. I'm glad you weren't tricked by that answer number 3, because remember, the fever is in the afternoon or evening, and the night sweats bring the temperature down to normal, so he awakens with a normal temperature. Let's do another question. An adult has a positive tuberculin skin test. The nurse should explain to him that this means he has which of the following: active tuberculosis, old tuberculosis, contact with the tubercle bacillus, or miliary tuberculosis. And the correct answer to this question is answer number 3. The positive tuberculin skin test simply means that he has antibodies against tuberculosis. Another question for us. The nurse observes that a client's family keeps leaving his isolation room door open, stating, quote, he feels closed in, end quote. He is assigned a private room with monitored negative air pressure due to his diagnosis of pulmonary tuberculosis. What is the most appropriate action for the nurse? 1, educate the client and family about why the door must remain closed. 2, notify the client's physician to see if isolation can be discontinued. 3, post a no visitors sign and ask the family to leave so the door will remain closed. Or 4, spend more time in the room with the client. And the best answer here is answer number 1. Let the family members know why it's important for that isolation room door to be closed. Now, let's think for a moment about isolation and the patient who has active tuberculosis. As we saw a few moments ago when we talked about the treatment of tuberculosis, we saw that this treatment could last 6 months or more. So do they need to be in isolation the whole time that they are receiving drug therapy for tuberculosis? And the answer to that question is no. They don't need to be in isolation the entire time. They need to be in isolation until their sputums are negative. And this is going to be 10 days, 2 weeks, something like that. So after 10 days or 2 weeks, we're likely to do more sputum specimens. We'll do another 3 specimens. If they're negative for tuberculosis, then we can dispense with the respiratory isolation. The patient is not considered to be actively communicable at that point. Now, I'd like us to think a little bit about histoplasmosis. Histoplasmosis is a fungal infection of the lung. The fungus likes to grow in bird and bat manure. So if the question asked who would be at risk for histoplasmosis, a chicken farmer, someone who has parakeets, someone who explores caves where bats like to play, might be at risk for histoplasmosis. Even city dwellers, because pigeons, and you know what pigeons do to statues and park benches and air conditioners, they leave their droppings behind, and so that could also the histoplasmosis could be in those droppings. Now, the symptoms to histoplasmosis are similar to tuberculosis in that you can have the cough and the respiratory symptoms. There is a skin test similar to the tuberculin skin test that can help to diagnose histoplasmosis. Once the diagnosis is made, the patient will need antifungal drugs. And amphotericin B is commonly used to treat histoplasmosis. Some of the nurses who give amphotericin B call it amphoterrible because this drug has terrible side effects. This drug has such serious side effects. Most everybody who takes the drug gets a fever, local phlebitis, kidney damage, anaphylactic shock, and bone marrow depression are also relatively common. This drug is so toxic that we usually give 3 drugs to reduce the side effects of the drug. Tylenol or acetaminophen for the fever, and steroids and Benadryl to help reduce the other side effects. Imagine a drug so toxic that we need to give 3 other drugs to reduce the toxicity to it. Another question for us. Amphotericin B is prescribed for an adult who has histoplasmosis. Which nursing action is essential because he is receiving this medication? Cough and deep breathe every 2 hours, give frequent skin care, administer oral hygiene QID, or monitor intake and output. And the best answer here is number 4, monitor intake and output. Because remember that renal damage was one of the major side effects of amphotericin B, or that drug affectionately called amphoterrible. Another thing to remember about amphotericin B is it will probably be given IV to this patient, and it's one of those drugs that's a little light sensitive, so you might need a paper bag over that as you administer it.